Hello and good afternoon, everyone. I'm Art Rascone. Welcome to the Midday. Here's a brief look at your news update this afternoon. The North Texas salon owner, who's now behind bars for refusing to close her business in the pandemic, could get out of jail very soon. Governor Greg Abbott announcing today that business owners should no longer be thrown in jail for violating orders to stay shut down. Abbott went on to say, quote, "Throwing Texans in jail who have had their businesses shut down through no fault of their own is just simply nonsensical." All right, joining us, ABC's chief medical correspondent, Dr. Jennifer Ashton. It's always good to see Dr. Ashton with us. Doctor, thank you so much for joining us this morning.
Thanks for having me, Art.
I should say this afternoon, now that it is afternoon. But Dr. Ashton, you've been dealing with this for so long. We see you every morning and every evening as well. Is there something new about COVID now that we're beginning to reopen that we should really keep in mind?
Well, I think, as you know, we're speaking to members of the coronavirus task force, top epidemiologists, infectious disease specialists, public health officials, pretty much on a daily basis. And I think the message that keeps coming up over and over again is that this virus is not going anywhere. Just because cases are going down does not mean the virus has mysteriously disappeared. And so it's a matter of figuring out how to lower risk, how to protect people's health, how to mitigate risk, and having the ability to both step on the gas and reopen, as well as step on the brake and backtrack if we see cases going up, because we have to remember that those cases are not just statistics, they represent human lives and people's health.
And speaking about those cases going up, Texas cases continue to climb, but also the testing in all of these areas continues to increase as well. So wouldn't we naturally see an increase in testing, and should we be more concerned about the hospitalization of individuals? I think that's the number that I know that the governor of Texas is really watching over the number of cases.
Very important questions, and there are a couple of data points that people will be looking at and should be looking at. And you're right, it's not only deaths, it's not only hospitalizations, it's not only confirmed cases, but it's about percentage of cases being run that are positives. And yes, absolutely, when you look for something in medicine, you will find more of it. So with more testing will come more cases, but we do have to have an idea in terms of surveillance of what this virus is doing in the community, because what would be a disaster is if we see a massive uptick in cases with patients presenting to the hospitals, which are already busy taking care of the average everyday emergency, and there will be no capacity to do both. So that's why you have to look at all of those numbers, not just one.
Very good. Now, tonight, right here on ABC 13, we're having kind of a town hall discussing the disproportionate number of blacks and Hispanics that are being affected and why that is and what we can do to help stem that. And what would be your primary advice, I suppose, to anyone of color who, because the numbers are growing in that area?
For sure, and that is a massive issue with this pandemic. But we have to remember, it's not that it's been identified with this pandemic, it's that it's been highlighted and magnified with this pandemic, because we know that African American people are at greater risk of high blood pressure, diabetes, heart disease, obesity. So what can we do in the setting of a pandemic? More targeted prevention efforts, diagnosis, treatment, testing, all of it. This is a vulnerable population, and so it does require and deserve special attention. We have cases in the country, for example, in Louisiana, where African Americans represent about 14% of the population and about 40% of cases and deaths. So when you see numbers like that, you have to be able to tailor your treatment in medicine to the patient, and in this case, to the population. Okay,
very good. Now, one last question, Doctor, and then we'll let you go, but that's about the young ones, our children, especially now that Texas is beginning to reopen. Stores are open, retails, theaters, bars and salons, and those things are going to be opening up tomorrow. And then next week, you have gymnasiums opening. What about those who are very young, and what should we be doing to kind of guard their health as well? I know that you've had some special reports regarding them.
A couple of things are, number one, overall, for some reason, COVID-19 doesn't seem to be making children or the pediatric age group very, very sick. They represent about less than 3% of all confirmed cases. But that doesn't mean they are immune, and we're starting to see this mysterious and serious illness sporadically, especially in states like New York, associated with COVID-19 in children. So that is still under observation. And the second thing is we have to remember that even though children might not get very sick with COVID-19, they could potentially spread the virus to others.
Sure.
So again, this is a different population and should be tailored to their needs.
Very good. Dr. Ashton, thank you so much. We appreciate all of your terrific advice and counsel as we move forward with this COVID-19. Thank you for joining us from New York.
Thanks for having me, Art.
All right, always good to talk with Dr. Ashton, so informative, and of course we learn so much all the time. You can watch her on GMA as well every morning. Thanks for joining us for the Midday. I'm Art Rascone. Have a terrific day, and we'll see you back here tomorrow, same time, same place, and thumbs up. Tomorrow is Friday, and then we'll get into the weekend. We'll talk to you later.